Well, welcome to this talk. I'm not quite sure where it's going to go, but there's some interesting issues, some of which are completely, potentially horrific, beyond description. Now, there was a conversation picked up on hot mics between world leaders, Vladimir Putin, Kim Jong Un and Xi Jinping. And there they appeared to be joking about organ transplants and living to 150. So how likely is this that these people could be around till they're 150? So I'm going to play you the video in a minute, but this is these are the people involved here. So there was Vladimir Putin, aged 72. There was Kim Jong Un, who's 41. Oh no, that one's Xi Jinping, of course, who's aged 72. And this one is Kim Jong Un of North Korea, of course, who's aged 41 or 42. No one's quite sure. But clearly from a superficial inspection from that photo there, you can see is somewhat overweight. So they were the individuals concerned. Now, they're talking here about organ transplants. Now these three photographs I've showed you, these individuals aren't really known for their jocularity. They're not the sort of blokes you'd have a laugh with down the pub, to be quite honest. No, they're probably not, are they? Yeah, you wouldn't have a chuckle over a few pints with these guys. So were they joking or were they being serious? Well, I'll let you make your mind up on that. But the implications are quite horrendous if we're talking about organ donation. Now, there is evidence from some part of the world that prisoners, for example, are tissue typed, blood typed, and then potentially at a future date their organs are removed. And the reason that this is so frightening is that if you want to take a kidney after someone's death, or a liver or a heart, you don't go to the cemetery and dig one up that's been dead for 3 days. As soon as the circulation of the blood stops, and as soon as the oxygenation stops, the condition of these organs will deteriorate to the point where they're useless within minutes, really. Certainly within 5 or 10 minutes, I would have thought, for kidneys and livers and hearts. Probably less for hearts. So these organs have to be removed when the blood is still being oxygenated and the heart is still beating. And this is quite a frightening prospect, because it raises the prospect of organs being removed from living people. Now, of course, this would have to be done by very, very skilled surgeons, and the patients would have to be controlled by anaesthetists. But the thing is, if you're going to open body cavities, then you get spinal reflexes, and the body cavities won't let you, even if the patient's unconscious. So they have to be given muscle relaxants, which means you can't move. And that makes it easy for the surgeon to gain access. But the trouble is, if you've got muscle relaxants, if your muscles are relaxed and you're paralysed so you can't breathe, you can still be fully conscious, which gives rise to some horrendous implications. I'm not going to go any further with that because it's just too frightening to think about. But there are examples from the Second World War where this happened in Japan, for example. So let's listen to the video now, and then we'll look at what they said. Anyway, if you're bored with this video already, I'll give you the bottom line. No, these people aren't going to live till they're 150. And it's rather pretentious to think they can. Based on American data, a 72-year-old, how likely is it a 72-year-old man will live till they're 82? Well, it turns out there's a 76.6% chance based on 22 American data. So in the year 2022, For a 72-year-old man, the probability that it would reach 82 is 76.6%. In other words, there's a 23.4% chance he'd die. And I would say this applies to these gentlemen as well. I think there's basically a 1 in 4 chance they're going to be dead in the next 10 years. So for Xi Jinping and Vladimir Putin, a 1 in 4 chance they're going to be dead in the next 10 years, I would have thought, even with transplants, as we'll come on to. Now, if the probability that these 72-year-old men will reach their 92nd birthday is much less, of course. The chances of them dying in the next 20 years are 74%, based on US data from 2022. In other words, they've only got a 26% chance of reaching their 92nd birthday. And that's based on data like this. It's not quite the data I got it from. This is 2015 data. There we are. So this is age of death in the United States. Now, this is quite interesting. This is the probability of dying in any particular age-adjusted time period. Now, this is the data from 1950 here. And these are the ages along here. So we can see people in 1950. First of all, we see infant mortality was much higher in 1950 and much lower in 2015, where the second lot of data comes from, which, of course, is good. But then in 1950, people were always likely to die earlier, people that died in 1950 compared to people that died in 2015. So in 2015, the modal age of death, with about, 17% of people died at the age of 87 in the United States. And then, of course, after that, the probability of death increases rapidly until you get to about 110 there, where there's basically no one left alive. And I did do a quick check on this, which is really quite interesting. The oldest person ever to have lived, apparently, is Jeanne Calmeny from France. Bad pronunciation. She died in 1997, aged 122 years, apparently. 122 years, 164 days. Now, as far as I know, this is the only human being that's lived beyond 120. The oldest current person alive is Ethel Caterham from the United Kingdom, born on the 21st of August 1909, currently aged 116. That's the oldest person at the moment. And the oldest man is a mere 112. That's Joao Marinho Neto from Brazil, born the 5th of October 1912. So basically, there's only one human being ever in history that I'm aware of that's documented to have lived beyond 120. So I don't think these gentlemen are going to. But let's look at the conversation that they had, and it is a bit frightening. So first of all, Xi Jinping. He said in these days, 70 years old, and presumably due to the tenor of the conversation, he was meaning to say that at 72 you're just a spring chicken, which of course he's got a vested interest in saying because he's just over 70. So yeah. In the past, it used to be rare for someone to be older than 70. These days, they say 70s one is still a child. Not so. Chances of dying by the time you reach 70 are pretty good. Anyway, Putin or Kim Jong Un, because this is translated into Mandarin. So one of them, I suspect it was Kim Jong Un, said this. So human organs can be repeatedly transplanted. Well, no, I'm not sure they can really. But anyway, this is what presumably Kim Jong Un said, unless it was Putin said this. But it sounds more like Kim Jong Un speaking to me, I would guess. So you can get younger and younger in spite of age. Well, a particular organ can be young, but the rest of you will be old, of course. So not scientifically accurate. And might be able to stave off old age indefinitely. Well, no, that is completely wrong. You can't. Anyway, Xi Jinping said it's predicted in this century it might become possible to live to 150. I disagree with Xi Jinping there emphatically. There's no reason to assume he's not well informed by his medical advisors, but maybe he's hoping to live to 150. But trust me, he's not going to. So what I did then was I looked at here the key leading causes of death in the United States. So this is key leading causes of death in the United States 2022 data. Check on the link for yourself. Now, the leading cause of death in the United States in 2022 was dementia and Alzheimer's disease. Now, you can't have a brain transplant. Trust me, you can't have a brain transplant, obviously. So you can change your kidneys and livers and hearts as much as you want, but I would have thought all that's going to do is increase your chances of dementia and Alzheimer's disease. Ischemic heart disease, well, technically you might think you could have a heart transplant, but if you've got ischemic heart disease, basically that means you're arteriopathic. So although 10.3% of people die of ischemic heart disease, the heart transplants we do tend to be in younger people who have conditions like viral cardiomyopathy, not ischemic heart disease. So again, one of the second leading cause of death would transplants significant. So in that one, transplants definitely wouldn't prolong life at all. In that one, it's unlikely that transplants would prolong life. So they're on a hiding to nothing again there. Chronic lower respiratory disease, 5.2% of people die. Well, I suppose, again, you could have a heart-lung transplant. But again, the people that have chronic lower respiratory diseases tend to have other diseases as well. So again, I don't really think that would make too much difference to their longevity. Cardiovascular disease, stroke and things killed 5% of people. And again, you can't have a brain transplant. So this idea that they were joking about, or were they joking, that you could just keep having new organs, no, they're not going to live. They're not going to live to 150 with new organs. Just imagine you had if you were 120 and you had an organ transplant. I mean, the older you get, the more dangerous surgery becomes. And of course, anytime you have a major organ transplant, you've got to take rejection drugs for the rest of your life. You don't just have a new kidney and then walk away, thank you mate, done and dusted. No, you have to be monitored really carefully for rejection, and you have to take anti-rejection drugs, and these lower the efficiency of the immune system, which of course makes infection more likely. So this idea that an organ transplant can simply do the trick is not viable. Malignant neoplasm of the trachea, bronchus and lungs. So again, cancer. If you did get cancer in the lung and you did a transplant straight away, okay, that would probably work. You'd have a new lung without cancer. But of course, very often by the time lung cancer is discovered, it's already spread. Lung cancer has a particularly bad prognosis still. Influenza and pneumonia became one of the top causes of death in 2023. So infections, you don't do organ transplants for pneumonia because the person would already be sick and you don't want to be operating on sick people. So again, no, organ transplants not going to prolong their lives. It sounds like these are on a bit of a hiding to nothing, these great world leaders. Other circulatory diseases. Well, again, if you've got disease of the blood vessels, it's blood vessels of the whole body. So you might have reduced circulation to the legs. You can't do a leg transplant, can you? Cardiovascular disease, stroke again, brain being affected, you can't do anything. Chronic diseases, chronic bronchitis. Again, you could potentially do lung transplants, but again, in people that were already poorly, these really wouldn't be very effective. Other leading causes of death, lung cancer we've already mentioned. Other cancers, again, by the time a cancer spread, organ transplants are going to be completely useless. Early monitoring, of course, we want to detect cancers as soon as we can, but transplants, again, aren't going to be an answer. Diabetes and metabolic disease. Okay, there's some talk of pancreatic transplants or giving some beta cells, so there's some evidence of hope there, but at the moment, that's not really a realistic prospect. Kidney disease, yes, you could do a kidney transplant. Liver disease, yes, you could do a liver transplant. That they could be effective. Parkinson's disease, again, it's the brain, it wouldn't be any benefit. Severe infections, again, no benefit. Accidents, unintentional injuries, of course not. I suppose you could fall over, damage a kidney or liver and get it replaced, but not really. Suicide, self-harm, well, obviously not. Chronic liver disease, cirrhosis, yes, organ transplants would be effective in that case. High blood pressure disease, no, organ transplants wouldn't be effective. Dementia of other types, again, you can't transplant a brain. So how likely is it that these gentlemen are going to live till they're 150? Zero. And I would think that the probability of them dying, even with the best medical care in the world, which we can assume they have, aren't going to deviate much from the American pattern of death. So, okay, it might be slightly better, but this is their lifetime probability of dying. It's going to follow pretty well that pattern. Okay, it might be slightly better. It might be kind of, that their line might be kind of out here a bit due to intensive, absolutely brilliant medical care, but it's still going to go down dramatically. And as they get near later life, the chances of dying are going to massively increase, whether they have transplants or not. But old people aren't fit for transplants. So their ideas of transplants prolonging life are simplistic and a completely false hope. Thank goodness for that. But it doesn't take away the threat of organs being taken from living donors, as we know they are. Now, I have got some other stuff on organ transplants and organ theft. I'm not going to do that in this video. But for now, let's just note that the teacher said this. To everything there is a season, and a time to every purpose under heaven. A time to be born and a time to die. A time to plant and a time to pluck up that which is planted. Pretty soon, just like you and me, these guys are going to be plucked up. So they're fundamentally wrong. Let's hope they're just having a joke. Hope you found that interesting. I did. I might come back with more on brain death because it is interesting. It has something I've got some experience of from my working life. But for now, thank you for watching.